Body composition testing is important in assessing your risk of obesity-related diseases such as high blood pressure, type 2 diabetes, high cholesterol, coronary artery disease, and certain cancers. Skin calipers are specifically used to measure percent body fat, and by use of measurements and calculations, it can be determined what categorical range the individual fits in by comparing their percentage to a body fat standards chart. For this procedure, you will need a skin fold caliper, a measuring tape using centimeters, a Sharpie, and a chair. Please note that all measurements are taken from the right side of the body. For the tricep measurement, make sure the subject bends at the elbow with a 90-degree angle. You will then measure from the acromion and the olecranon process. Find a midway point and make your first mark, where the calipers will be placed. Then make your second mark, 1 centimeter above the midway mark, which is where you will pinch. For the suprailiac measurement, make sure the subject stands straight with arms down to get an accurate reading. You will measure at the diagonal fold in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest for your first mark, then 1 centimeter above for your secondary mark. For the thigh measurement, make sure the subject puts their foot up on a surface that allows their knee to be bent at a 90-degree angle. You will then measure at the anterior midline of the thigh from the crease at the hip and thigh to the proximal border of the patella. Your first mark will be made in the middle of the measuring tape, and your second mark will be made 1 centimeter above the first. Now it's time to use the calipers. At the pinching mark, you will firmly grasp a skin fold of subcutaneous fat with the thumb and pointer finger with your left hand, holding the calipers with your right hand. You want to make sure that the caliper is perpendicular to the skin fold and halfway between the crest and the base of the fold. You want to begin with fingers 3 inches apart and perpendicular to the long axis of the site, then slowly bring fingers together, lifting subcutaneous fat. To make sure that you do not have muscle, lift the grip up and away from the body, roll the fold between your fingers, and measure. Note that when measuring the thigh, you want the subject's foot to be propped up on the top of the foot so that the muscle is relaxed. While maintaining pinch, release the scissor grip of the caliper claws, wait 1 to 2 seconds, no longer, and record your measurement to the nearest 0.5 millimeters. You want to take at least 2 measurements of each site. Unless the measurements are greater than 2 millimeters from each other, then would you take a third. You must rotate the sites to allow the thickness of the skin from the pinching to go down. This is the body density calculation for women. You will use these numbers and plug them into a calculator. For the sum of the 3 skin folds, you will first take the average of each site and then add up the 3 averages for the tricep, suprailiac, and thigh and place within the parentheses. This is the percent body fat equation. You will use the answer that you got from the last equation and plug in where it says body density. Your answer will be your percent body fat. These are the body fat standards for men and women. Please refer to the women's section. This will tell you whether you're very low, low, optimal range, moderately high, or too high. And this is why it's important to assess body fat. From here, we can determine whether you're high risk for obesity-related diseases. It is important that you inform your clients on the risks associated with obesity and related diseases, as well as the risks that are associated with extremely low body fat. It works well to inform them on the benefits of staying in the optimal range as well, for positive encouragement. We hope you enjoyed this video and were able to successfully grasp the procedural concepts of how to measure body fat through skin calibration.